Today we are joined by Dr. Fabian Rotenberg, who is a fellow of the College of Foot and Ankle Surgeons. Welcome to the show today. Before we dive in, it's important to remember that the information we provide is for informational purposes only. Every situation is unique, and decisions regarding your health or legal matters should be made after consulting with your own doctor or lawyer. Our aim is to inform and empower, but personal circumstances require personalized advice. We'd like to take a moment to thank our sponsor, findagreatattorney.com. If you or a loved one has been injured in an accident, finding the right lawyer can make all the difference in getting the compensation and support you deserve. That's where findagreatattorney.com comes in. They're a free lawyer referral service that connects accident and injury victims with the best attorneys in their area. With findagreatattorney.com, you can be confident that you're getting a highly qualified and experienced lawyer who will fight for your rights. The best part? Their service is completely free. So you have nothing to lose and everything to gain. If you're in need of legal assistance, head over to findagreatattorney.com and let them help you find one of the best lawyers in your area for your case. So why don't we start at the beginning? Actually, I'll go back and say this. I have been practicing personal injury law for about 40 years. And I have never had a case where I've had a podiatrist as an expert. And then I was talking to some people in my office this morning about coming here today, and I don't think I've known 5 people that have been to a podiatrist. And we were talking about the fact that the feet is probably one of the most used body parts and probably one of the most neglected and probably one of the body parts that's not looked after by a doctor on a regular basis. So I wanted to just start and ask you if you could explain what podiatry is and why you got into that field.
Okay, so you are totally correct that the feet are very neglected. In a city like New York, people walk all over because it's a very good way to go from one place to the other when we have so much congestion. The feet are extremely important as they basically help you get from one place to the other, okay? And people have neglected them until they start hurting. But people have been very good at accepting to have a part of their body that hurts. So they come to the office usually with a problem that could have been resolved a lot sooner had they come visit a podiatrist. You often go to the doctor and keep your shoes and socks on. So they go to their internist or dermatologist, and that part of the anatomy has not been looked at. You have patients that I've seen that had a physical maybe done the previous week, but they come to me with a problem and say, well, I was just at the doctor. And I ask them, had you had their socks and taken off? No. Well, once that happened, you start discovering a lot of problem from anatomical issue or dermatological issue that are causing problem, but people have learned to live with it. Especially women, they have a higher tolerance for pain, and if they want to wear shoes that are fashionable, they will, vanity is a very good anesthetic. But eventually, they will come to me, especially because I'm a woman and I like to wear fashionable shoes. But today, you can find shoes that are both biomechanically sound and also aesthetically pleasing.
Wow. That's probably going to be one of the big takeaways from this whole episode.
You can look good.
So there are a number of misconceptions I think people have about podiatrists and podiatry itself. So why don't you kind of give us a little bit of a flavor as to what podiatry is? I mean, does it involve just the foot? Does it involve the foot and the ankle? What types of problems might bring one to see a podiatrist?
Sure. So podiatry has evolved. People have in their mind chiropody, which is, people taking care of corn and calluses and nails. Well, Podiatry is after college. You go for 4 years of training, and then you have a residency between 2 to 3 years. Some programs also have 4 years. During that time, you can train in surgery, you can train in biomechanic, you can train in pediatric. So the range of what we can do has increased over the years. A podiatrist today, most podiatrists need to have a residency and need to be board certified. After your residency, you take boards and in different specialty that you choose to be. In New York, a podiatrist is limited to the foot and ankle, but can only do surgery cannot do surgery in the ankle. He might be able to do arthroscopic surgery, but if you're talking about ankle replacement, it's not, in the state of New York, it's not possible. In the state of New Jersey, the podiatrist can do, the ankle is included.
Really?
Yes. In some states, you can even go up to the knee. So things really change from the one state to the other.
So I assume that most people see you when they have an acute problem. But are there situations or patient types that should be seeing you on a regular basis?
Yes, people who have chronic disease, in civilized countries, we have rampant diabetes. And it has been, diabetes doesn't just affect, having high sugar, but one of the symptoms is people have neuropathy, which is they lose some feeling. Now, losing some feeling doesn't mean you don't have pain. You just have a different kind of pain. So patients who have diabetes, especially long-term, have issue with their lower extremity where the nerves basically has been damaged from long-standing diabetes, and they have not having sensation cause a problem in their feet where they could have an injury and they're not aware of it. They could have a blister, not even noticing that it's a blister. The blister get infected. They still don't notice. They might notice it when there is a full odor coming out of their feet, or their spouse or girlfriend or boyfriend tell them, what's going on there? It doesn't look good. But and then they come to me. There is also, they can have, because the muscle don't work properly, they can get chronic deformities, rigid or flexible hammertoes that cause problem in their shoes and give them pain.
So let me ask you about neuropathy. So my understanding of neuropathy, it's almost like when your foot falls asleep.
It's one of the symptoms, but you could have neuropathy where you feel tingling. You could have neuropathy where actually your foot perspired. You could have neuropathy. Neuropathy can display itself as many colors. Some people feel severe burning. Some people at night, they don't know what's going on. They feel like ants are eating, are crawling on their feet. Neuropathy doesn't necessarily mean that it's totally numb.
And then how does it affect your ability to walk or to ambulate?
So as we walk, we get feedback. We have something called proprioception. The foot adjusts to the terrain. If one has ever seen the anatomy of the foot, there is many bone, and all those bone are flexible in order to adapt to the terrain. Neuropathy will not allow you to adapt. Therefore, you go through a range of motion to the maximum and you injured yourself. You're not able to compensate, so you fall. You're not able to compensate, so you are unable to adjust to the different terrain. Neuropathy will not give you the proprioception to be able to adjust.
And if you have neuropathy, that's not a condition that you can stop or reverse. It's a condition that you can basically just put it into abeyance so it doesn't get any worse?
Well, it depends what kind of neuropathy. Diabetic neuropathy, it's hard. If you control your hemoglobin A1C, which is a test that tells you how is your sugar doing, you can control the neuropathy. Neuropathy has also different stages depending how far gone and how much damage to the nerve itself. If you have neuropathy from an injury in your back, if there is a blockage and the blockage is being removed, if you have a vertebrae that impinge on the nerve and the vertebrae is being fixed, then some of the neuropathy can come back. People who have carpal tunnel, it's a form of neuropathy. But you have also in the feet tarsal tunnel, which is another form. It's a nerve being injured.
So are most of the podiatry issues that you deal with nerve related?
No, it's one of the things that it's one of the issue that we see. We see a lot of anatomical issue. We see a lot of men or women who have bunions, hammer toe. I have lately seen a lot of people who are soccer players and have frozen toes because they have a lot of arthritis in their toe, and they're having difficulty walking because you need the dorsiflex. You need a certain amount of flexibility in your toe in order to move from one step to the other. All the joints need to be able to move, and if one doesn't move, then the other joint have to take over. And the foot was built more like a bridge. You know, there is pressure on the heel, and then you have an arch, and you have your toe. So it's more like a triptych, a tripod, not a triptych,
right?
A tripod. And if that tripod is compromised, then your whole stability. Imagine a building whose foundation has not been laid properly. Then it might look good for a while, but eventually you're going to see problem in the building. The structure going to start being damaged, and there will be weak link in the building, and down the line in one's lifetime, if things are not properly taken care of, the body cannot compensate forever.
So let's assume somebody has a frozen toe, and I guess that is where, due to arthritis or something, it's not bending as it should.
Yes.
So what can you do to alleviate that condition or make it easier for that person to ambulate or walk around?
Okay. If it's a frozen toe from trauma, i.e., as I say, a lot of soccer players or someone, was climbing and he had an injury, but it was not so bad. He didn't pay attention, but the body, the joint got damaged over time. The most easy procedure is to clean up the joint and try to remove all the arthritic changes. You can also inject fillers in the joint to try to lubricate. Again, the lubrication of the joint, there is many different protein that can be injected. It's a temporary. It will not last forever. You can fuse the joint if it's very bad. You can try to put an implant, a elastic implant, to try to reproduce a joint, but it doesn't last forever. So it depends. I have to assess the age of the patient. I have to assess the level of damage. I have to assess their general health. If they have a systemic condition, if they have rheumatoid arthritis, even if I clean the joint, it will come back. And it's not usually just one joint. The easiest one to treat are the one where the patient is healthy, but it's arthritic change secondary to trauma.
So when you have certain types of patients, mainly diabetics, should they be seeing you before their problem? Maybe you can do you talked about this pressure, smart soles or something. You want to talk about that? How you maybe can prevent problems from happening, especially in the diabetics.
Right. So patients don't usually know they have diabetes unless they've been careful because it has run in the family and they had a sibling or father that went from one toe amputate and more toes and the knee, and then up to the knee became amputation. Then suddenly they become much more wary of if they will end up being diabetic, so they're being followed by the internist. But often, patients have been getting up several times during the night, and they don't think that there is any problem because it happened once or twice, and then it went 3 times. They get used to waking up. So they don't necessarily know that they have diabetes. When they do have diabetes, if their internist is properly educated, then they will be seen, will be referred to a podiatrist for an evaluation. And then I see them regularly. Now, when I have a diabetic, I also send them to the ophthalmologist because often whatever is happening in the feet is also happening in the eyes, and they're not aware that their vision has gone down. And suddenly they say, I didn't know, but suddenly, I have to wear glasses. Okay, or I see so much better now. Or I was tripping. Things happen over a long period of time, and people get used to, and also a lot of people deny. They don't like to know that they have an issue. They try to avoid it. So to go to those there is today, thanks to AI, thanks to different modality, there is insert that can be put inside the patient foot, especially inside the patient's shoe, that will pick up pressure, temperature increase, and if the patient look at the insert, or sometimes the insert can be plugged into their computer, and someone can read the information, and we can inform the patient that this is an area that will possible breakdown and develop an ulcer. Prevention is the number one issue that prevention is the number one area that we try to implement and teach diabetic to watch, because it's a lot easier to prevent than to treat.
So before we started filming, we were talking about a number of different things that you do in your office. And I was fascinated to hear about the kind of the computer mat that you have somebody walk across. And as somebody who's not conversant in that type of area, I was fascinated to hear about you talking about the heel strike and the how the pressure moves, and whether they put more pressure on one foot or the other. Maybe you could talk about that test, what it shows, and why that's important.
Okay. So living in New York City, and I'm on the Upper West Side, I see a lot of athletes. Athletes are very good patients because they're usually healthy, but they would like to improve their time, or often they have some issue and they come to me because they went to the runner shop to get a certain pair of sneakers, but they still have issues. So they come to me and I do a gait analysis where I have them walk on that mat, which has a lot of sensor, and it's linked to a computer that gives me information on a dynamic, meaning I have them walk on that, take several steps, sometimes even run and land on the gait scan, and I can analyze the pressure, the length of their strike, which muscle they're using, one foot versus the other, if they're favoring one side versus the other, the level of their pelvic, if they the body, as I mentioned before the interview, the body is not exactly symmetrical. And if you strain one area over and over more so than the other, then there is damage that happens. Often they have hip pain, they have knee pain or ankle pain. And while they run, often the problem, because the endorphins are there, they're not aware of the problem, especially we have a lot of weekend warrior, and then they come the few days later, they barely can get up, they're in pain. So they still want to be active, and they come to me, and I can pick up things that the naked eye cannot pick up. So the Gait scan has been a very good tool. I use it also for diabetic to try to relieve the pressure in area where there is bony prominence. I use it in ladies who want to wear high heel and to try to offload the front of the foot. There is many different kind of insert. They call orthotics. Mm-hmm. You have them for different sport. You have for different type of shoes, and to try to increase the comfort and keep people to be moving around.
We wanted to take a quick break to remind you about our sponsor, findagreatattorney.com. Dealing with the aftermath of an accident or injury can be overwhelming. And the last thing you want to worry about is finding the right lawyer. Findagreatattorney.com simplifies the process by connecting you with one of the top attorneys in your area who specializes in your specific type of case. Whether you've been injured in a car accident, suffered a slip and fall, or experienced medical malpractice, Findagreatattorney.com has a network of experienced lawyers ready to help. And remember, their service is completely free, so you can focus on your recovery without worrying about the cost of legal representation. If you or someone you know needs legal assistance, don't hesitate to visit Findagreatattorney.com and let them match you with one of the best lawyers in your area for your needs. And we were talking also off camera about these weekend warriors and athletes in general and their sneakers. And, you had indicated that's important that you change your sneakers, get new sneakers on a regular basis for a number of reasons. Could you talk about that as well?
So the technology in sneakers has increased dramatically. If you see sneakers that were developed 50 years ago, you wouldn't recognize. You would say, how could the person actually be an athlete with those sneakers? So there is different foot type. Not every foot is meant to fit every kind of shoes. So a lot of sneakers are built with a lot of shock absorption and are much lighter than they used to be. They also can be adjusted on many levels, in the heel, on top, at the front of the foot. Sneakers have, depending if you use sneakers for walking around, if you use sneakers for running, if you use sneakers for basketball, all sneakers have different function depending activity that you're going to do. Some people need sneakers that have a rocker because they have difficulty with propulsion. So the sneaker will have a curve, a rocker at the bottom, and it helps them not spending as much, its energy efficiency. You have also sneakers that store the energy at the heel strike and help you propulse. So there is so many magazines. Runners Magazine have a lot of information, and patient come in and they know so much more about sneakers that I do, because every few months there is a new sneaker on the market. So I get educated from them, and also I do my own research. But today you can find a sneaker for every foot type.
Now, let's say you're going to start playing pickleball. Everybody's playing pickleball. That's the new thing, right? How do you know which sneaker to get, or how does a runner know what type of sneaker to get? Do the sneaker stores help you with that, or do you help them with that?
A good runner stores can help, but often my athlete will buy a shoe and will not use it yet, and then they stop in my office and I examine. Beside the sneaker, I also mentioned that there is this type of socks that they wear, because the sneaker are good for shock absorption and to cushion in different area, but the material of the socks help with the moisture. If you have moisture in a sneaker, it will cause you increased blister. Also, it produces fungus love dark and moist environment, and if you don't have proper hygiene, the shoe that is an area where you have dark, heat, and material that are prone to host bacteria and fungus, it creates a medium for problems. So socks are also very important beside the sneaker itself.
So let me get this straight. You tell them to go to the store first and buy something, and then you make it better by putting inserts in or analysis?
Depending their problem. I don't get to see everybody, but obviously the one who come, they've tried the stores and it hasn't been good enough. So they come to me. I can do a Gait scan to analyze what really is the problem. A lot of people are not sure what is their problem. Some people come, they get shin splint, but they don't know that what's the problem. So the Gait scan can help me focus. And if I take care of that problem, some of their issues disappear.
So what about this pickleball? Have you seen, because everybody's playing pickleball. Are there pickleball injuries of the feet that you've been seeing, or it's mainly
pickleball? It's a cross between ping pong and tennis. Tennis is, you do have problem because you accelerate and you short stop. So if they have issue, if their toes are not, if often the second toe, in some patients the second toe is longer, and so they can get microtrauma from the short stop. Repetitive microtrauma become a big trauma at the end. So I do get, hammer toes, I get blisters, I get the issue with the toenail. Pickleball is not again, it depends who plays, but it can be very intensive, but a good running sneaker should be fine. I'm sure there is out there someone who made a pickleball sneaker.
Yes, I'm sure there is.
I'm sure there is. I haven't yet seen it.
But you think a good running shoe should be fine for pickleball?
Yes, I do.
Yeah. Okay.
I wanted to discuss, because we're talking about different injuries to the feet. So if a person is at home, what problems should they consult a podiatrist for rather than trying to treat at home?
Okay, it's funny you asking me this. This past week, I saw 3 people with splinter. Okay, one patient, they were walking barefoot on their wooden floor, and they thought they knew something had, penetrate their skin. One patient let it fester for about 3 weeks. Another one came the next day. So I had different lengths of splinter, wooden splinter. So it's nice if they try to remove it, but if you know that what the splinter you pull out is broken, there is another piece inside. Okay, last year I had someone who was walking on the boardwalk in New Jersey, and this was one of the longest splinter. Was probably, no kidding, was probably about a foot long.
What?
Okay, yes, and it's just I couldn't believe that it was there in his foot. Okay, it was from basic, and it hadn't caused really any pain. He just knew there was something, how it didn't get infected. I started pulling, and it had gone from the heel, and it went all the way to his second toe.
Oh my gosh.
Okay. And I had actually in 2 pieces because he had walk on it. And it was amazed. We took picture, actually was really, and he had no infection, nothing. He was really a lucky guy. A huge splinter on his foot. But usually I get, splinter that are 1 to 2 centimeters. Sometimes I don't get everything out. I actually have someone, I got only a piece. She's going next week for an ultrasound. And probably I will have to take it out in the operating room because I wasn't able to get everything. So people also think that, a piece of glass, it's easily removed, but you can take an X-ray. We don't have glass that has lead anymore in it. So it can be quite challenging to remove foreign body. If you get it out, it feels very good, both for myself and for the patient, because it's very rewarding. They know it was not in their head. There was something, but it can travel, and that can be challenging. So that's something that this patient should see me. Also, if they have an ingrown toenail, many people do bathroom surgery. Nothing wrong with doing bathroom surgery. If you clean your instrument, you clean whatever you use, but often it gets infected. And if you have recurring issue, things should not happen over and over. Sometimes it might be something else. So if something doesn't heal, or if you have chronic problem with your feet, you should see a medical specialist.
Perfect. Why don't you jump into...
Okay, so we discussed before that you've had some personal leg pain, and do you want to discuss that injury and what happened after that?
Okay. So, being a medical profession doesn't prevent you from getting hurt or knowing where you need to go. You can also, like anyone else, once you become the patient, be sent to the wrong place. So I had a ski injury many, many years ago that was misdiagnosed. I am an expert skier, and I fell at the end of the day. So actually, someone at the end of the run hit me, and I went into a tree well, and I got myself out of the tree well, but you have to twist your body a lot, and you had your ski were buried, so everything was quite heavy. But eventually, I got out. I was able to ski down. Long story short, I was diagnosed with having some problem with my hip, an anatomical bump called a cam lesion. The cam lesion was removed. The problem was still there. I'm going to fast forward 7 years later, many surgery. It turned out that I have an entrapment of a lateral femoral cutaneous nerve. It's a small nerve it's a sensory nerve that runs on top of your thigh. The injury usually happen in people who are overweight, or in people like plumbers or electricians who wear a heavy belt around their waist with tools hanging from the belt, and the tools and the pressure cause entrapment and problem. I'm not electrician on the side. I'm not a car mechanic, or I was never. I do not fit the profile. So it took very long time to diagnose that was the issue. eventually I had a procedure done by a neurologist at Johns Hopkins, and they released the nerve, and I was free of pain for a very long time, for 5 years. But the pain came back. I will mention that I was scheduled to have a very extensive surgery where they would go from the front of my leg to my back. And I was very concerned. There was 3 surgeons that were supposed to be on the team. One surgeon had a medical emergency, so my surgery was postponed for 2 weeks. I decided to go see all my neurosurgeons. I had done all over New York, Philadelphia. I knew everybody. And someone suggested that there was a new device. Now it's not so new, that had been used on Israeli soldiers that had been injured in the army or had accident. There is in Israel, beside the injury from wars or from the army, there is also a lot of car accident. And they have a lot of people have peripheral nerve injury. This device is a nerve stimulator. The way you could relate to it, people know TENS units. So imagine a TENS unit that's much smaller that is implanted over the nerve that causes you the problem. And I don't have a solution. I am not without pain, but whenever I have an episode, I can use that external. There is an internal part and there is an external part. I can put the external part, it's a little battery kind, on top of the area where the implant is, and it kind of short the pain fibers, and I do not have the pain.
So we had an episode recently about a woman who was in a horrific car accident, and she is in chronic pain all the time. So why don't you just tell us what that pain was like for you and how it affected you?
I would say the pain was debilitating. At the time, I had a young child, 3 years old. He's now 21. And I was not able to be a good mother, to be a good physician, to be anything, because chronic pain can really wears you down. I was on many different kind of medication, pain medication, nerve medication, antidepressant, because all this can kind of quiet the pain altogether. So I was having a cocktail that was leaving me pretty much in a haze. I also were having regularly, I was having epidural to try to kind of numb the pain. I was wearing a patch with different narcotic on to try again to numb the pain. Well, all this take a toll. It affected my life on every level. It affected my marriage. It affected how I took care of my child. It affected my sense of well-being. Suddenly, I was from an athletic, healthy young woman. I was a basket case. And I was unpleasant, and I was very tense. I had issue with sleep. You name it, I had it.
And I think the most challenging thing for something like that is somebody will look at you and see you as being perfectly healthy, and they're unaware of all of the trauma and the pain and the anxiety that you're going through on a daily basis. And like you said, from going to bed at night to not sleeping to waking up stiff and sore and in pain, and then just having that constant thought process in your head about this is horrific, will it ever go away, it's debilitating, and then it makes you short-tempered. It creates so many problems. So I'm just thinking that the stimulator that you got must have been a godsend for you.
It was a lifesaver. I want to tell you that I've met people who I know have ended their life because the chronic pain was just unbearable. Thoughts like that have gone into people's mind. As I said, God sense, I was able to avoid that surgery that I have. Today, you don't keep people very long time in hospital, but at the time, they were keeping me almost a month. So it was a very extensive surgery. That the nerve stimulator made me from an invalid to a valid person. I also, being a woman, often I would go to a doctor and they say, it's all in your head. Okay, learn to live with it. They don't take you seriously. So anyone who has chronic pain, today, thank God, there is people who are specialized in pain. They are anesthesiologists who specialize in pain, and there is a lot of relief that's available. The nerve stimulator, there is many different kind. It has evolved since, I had it probably between 7 to 10 years ago. It has evolved. It's much more miniature. Many are implanted, and you can return to full activity.
So yours was implanted 7 years ago and you haven't had it replaced?
No, correct.
How big was it?
It's probably about 5 centimeters. It's very small. It's a coil. I was awake during the procedure. Actually, I wanted to be awake because I wanted to learn how it was going. The guy, the doctor who put it didn't want me to be awake, but actually, with my phone, I have a whole video. There was a test first to know if it was going to work. He was very confident that it was going to work, and as soon as they put the device, I knew I would be better. It needed some adjustment, but I right away felt that this could help me, because the try-on before we did the surgery, there was a try-on, and it had laser into the area that was my problem.
So how do you activate the coil, and how often do you use it? And
So there is something called the honeymoon period. I was telling Jeff that I hadn't used the device for about 3 months. I used it last night. It could be because, the weather was changing. It was going to rain. For a long time, I had an app that when the atmospheric pressure was below 30, I knew I would have pain. So since the device, it's not as sensitive to the weather, but they're not really sure what can trigger. But I've met many people who have the device who can be going for months, 6 months without any discomfort, and suddenly out of nowhere, there is a trigger. It's not food related. We don't know. It's not like I did more activity between yesterday and today. Last night, I had to wear the device for a number of hours.
And I would imagine, just from a psychological standpoint, knowing that you have the ability to trigger this stimulator makes you feel like you don't have to worry as much.
It's life-changing. I have to tell you, in all my luggage, I have list, but in my carry-on, I always have the nerve stimulator with me. That's number one, before lipstick.
Right.
Or heels.
Oh, heels, that's correct. Right. That's correct, yes.
So do you want to talk about other things that you do that are new, like the laser, and what's this laser for, okay, and a little more about the cushions, things like that are new?
Yes, so actually I bought the laser because I had heard that it could help with peripheral nerve pain. So I bought a laser. It's an MLS laser, and I treat many different kinds of pain and injury. I use it post-recovery from my surgery. I use it for people who have bursitis, tendonitis. It works very, very well without having to get injection or to take medication. It has different wavelengths, and those wavelengths stimulate different enzymes in the body that allow the cells to increase its activity and get rid of inflammation and pain. I use it for some diabetic, but it's long. For diabetic, it's not. You need at least 6 to 12 treatments for them to start seeing improvement. It can reverse. It's not. I have patients who it has reversed some of the problem with neuropathy, but then they need to come for a tune-up. They come every 3 to 6 months for a few sessions, and it has helped tremendously. I use the laser a lot for sport injury and for people who have inflammation. It speed up the recovery recovery following my surgery. Another thing that has been very good is fillers, that people are familiar, fillers for the face or area that in plastic surgery, it's being to fill an area that has been devoided of soft tissue. But I can use it a lot to replenish the fat pad that get atrophied, or women who like to wear high heels and they don't want to wear arch support and want still to be able to wear their high heel. They come in and I fill the bottom of it's basically an implanted cushion at the bottom of their foot. I use it also in people who have hammer toes or who have lesion in between their toes, a little bone spur that rub. You can put the fillers in between the toes. It lasts very long time because there is not as much pressure as the bottom of the heel. There is people who've had different kind of injuries and they have, let's say, a plate on the bottom of their foot, on top of their foot, and the plate, as they got older, get more prominent, and you can fill the area with a filler, and it's very rewarding because they feel better right away.
Let me ask you about the laser. Is it like a gun? Is it a wand? Is it a?
It's not. It's a machine that put their foot, in. I calibrate the laser to what wavelengths they will need. They sit in a room with the foot over the laser. So there is about 10 minutes, and that's how it is. And afterwards, there is a wand if I want pinpoint certain area. But there is two different heads, a large head and a smaller head.
And is this something that a consumer could buy or something that a doctor has to use?
So this machine is quite expensive. It used to be a very big machine, and actually my machine is an Italian machine that has been it cannot be used. It's pretty big machine. It cannot be used. There is different laser, handheld laser, that I think consumer can buy, but it's not the same strength.
Mm-hmm.
Do you need specific training to use the laser?
Yes, I was trained in actually Chicago, and I have one of my nurse that I send to Chicago to be trained. So if I'm not there, if I'm busy, she can train someone else.
And do you need lots of different treatments, or how often do you do the treatments?
So one treatment can help with the inflammation, but you usually need about, you start seeing result after 3 to 6 treatment.
And does the treatment its pain get better right away, or it takes a while?
In some people, they get off the table and they say, wow. Okay, but I don't know what is psychosomatic. If it's swollen, if I see the swelling decrease, it's not psychosomatic, okay? But sometimes people just knowing something was done feel better. Some you need a few treatment.
So you can actually see decrease in the inflammation.
Absolutely, that
wow,
yes.
That's very dramatic.
Yes, that is indeed.
Yeah.
I'm wondering, was, in your practice or in my practice, was there a pivotal moment or a patient that you treated or something that really brought you a great deal of satisfaction in what you were able to do for somebody?
So when I mentioned earlier that an ingrown toenail, is if it doesn't heal, it can be something else. So that was the first case where I had a patient that I diagnosed with a malignant melanoma. He would have lost his whole leg. Thank God he only lost a big toe. But since then, I've been a lot more on the lookout for moles or things that, whenever patient has a discoloration in area, I take pictures. I'm a lot more. And I have picked up over the years, lesions that need to be excised. That had I not been familiar, I might have not pay attention or not inform the patient.
And I think that's, again, that's a body part that, we look at our hands all the time. We look at our arms. We look at perhaps our chest, our torso. But very infrequently do we do like a checkup of our foot.
People don't like a lot of people don't like the way their feet look like. So they don't, I know a patient who had, terrible issue, and she would go to sleep. Her husband had never seen her feet. She would sleep with socks. She was so self-conscious. And I was able, I'm not going to go into the issue, what her issues were, but she was able, now she wears sandals. Many patients I know don't wear sandals because they're self-conscious. They were told it can never be taken care of.
And that's interesting that you say that, because I think a lot of people, if you were to ask them, do you like your feet? They would say, no, I hate my feet, or my feet are ugly. Or, I think people are just automatically programmed not to like their feet for some reason, which I don't know.
Correct. There is another thing that a podiatrist can help, like with Botox. You have patients who perspire tremendously from their feet, and it's always an issue. Well, you can inject Botox to the feet and you stop the perspiration.
Interesting.
Yeah, I know that when I was seeing patients, I always told my nurses, any diabetic, you got to take their shoes and socks off. And I would walk in the room and their shoes and socks were on because the patients didn't want to take their shoes and socks off. But that's so important to look at the feet, especially with diabetics.
Correct. Also, a lot of people go to salon, and unfortunately, the sterilization is not very good. So in a salon, I've tried to get the salon around me certified, by that I will go and check it. They don't want to be certified. But a lot of infection are picked up in salon.
What about the manicures and the pedicures? Do you see a lot of problems with that?
Very much so. A lot of my patients would like me to have, a room dedicated for medical pedicure. I haven't yet moved, I could have someone full-time doing that. But there is problem with contamination. There is problem with lack of sterility. On the hand, not so much because there are little containers with water that get thrown out. People who have those fake nails, permanent, it's very bad. Moisture get in between. You have fungus. You have different issue that can happen. The keratin is very sensitive. There is a reason that it's exposed. And constantly having nail polish apply, it's not a good idea.
What about tattoos? Have you seen problems with tattoos?
So I had a friend who she was a podiatrist, but she then went into tattoo removal. So she used to remove tattoos a little bit all over. I haven't seen many tattoos on the feet. They're small, they're cute little things, but not like you see, people having covered from, their arm.
Like a sleeve or something.
That's correct. I haven't seen a sock.
A sock?
Because you were
like
saying
a sleeve.
so
yeah.
I haven't seen a sock tattoo.
The other thing that we were talking about earlier are the two types of people I think that have chronic problems with their feet are people that are overweight, that have problems, reaching their feet and cleaning their feet and doing what they need to do. And the elderly. I know when my father was nearing the end of his life, he was just physically unable to bend over and do the things to properly care for his feet. And I think those two groups are groups that really have to be careful about their feet and perhaps, see a podiatrist on a regular basis.
Well, so these two groups have people that are secondary to circulatory issue. So yes, they do need to see a podiatrist. Often people are being brought in by a family member who suddenly came to visit, and so the horrific state of their mother, grandmother, and they bring in. Often there is some neglect. It could be neglect from the patient because if they're obese, they cannot bend over. Mm-hmm. On the Upper West Side, I have a lot of patients who come with their home health aid, and I teach them what they have to be on the lookout. And I don't have as many problems as I used to. I think education, even basic education, should not be taken for granted as far as moisturizing the foot, cleaning and drying very well in between the toes, offloading area that if people are bedridden, offloading area with different kind of cushions so there is not a chronic ulcer that can happen and be very debilitating.
Does Medicare pay for nails in certain patients?
Medicare will pay for what's called for routine foot care in patients who are diabetic or poor. You have to have the proof that there is poor circulation. So I have podiatry you have to have an endocrinologist, a vascular person, an educator, and the podiatrist. All this, it's a team effort to keep people able to ambulate and be healthy.
So does Medicare pay for the nails cutting for those patients?
They will pay for, Medicare will pay for patients who have vascular or diabetic issue.
How do you cut the nails?
Yes.
And how often would you do that?
Usually it's Medicare pay every 3 months. I have patients who need to come more often. So you appeal. Sometimes it gets rejected. Sometimes it's not. It's a lot of paperwork.
Yeah, okay. But every 3 months is a traditional...
Yes. Mm-hmm. 63 days, I believe, yes.
63 days. And
don't ask me. It was not done. Whoever decided, was not doctors. Probably were
They were actuaries.
Actuary, that was the word I was looking for.
2 months is too short, 3 months is too long.
Right, not 62, but 63. Yeah.
Actuary.
So, Doctor, I wanted to thank you for sitting with us today. There's been some terrific information that you've imparted upon us. I am going to go out and buy new sneakers later on today and look for the latest and greatest. And I think it's really important to concentrate on our feet and on good foot health. And you've given us a lot of information and things that we can do to make our lives and feet better. And
there is one more tip I would like to go. If ever you go shopping for shoes, do it at the end of the day when your feet are swollen. Most people go shopping for shoes, sneakers, early in the morning, and that's not a good idea.
What a great idea.
Thank you very much. And
Thank you for having me. It was a pleasure.
Thank you.